Good afternoon, everyone. I'm Dr. Subramanian, Assistant Professor in Community Medicine. I welcome you all to this webinar on the topic of how to select a thesis. I know in the busy schedule, selecting a thesis and spending time for it is very difficult. I'm here to simplify that for you. In this session, you will understand the key factors in selecting appropriate medical thesis topic. It will help you identify common mistakes and how to avoid them. Before starting the session, let's start with an activity. Take a paper and pen. Write down a core topic of your subject which you are interested in. In the center of the paper, once you finish writing the core topic that you are interested in, if you don't know what a core topic is, for example, if you're a medicine postgraduate, your core topics might be neurology, nephrology, rheumatology, and so on. So write the core topic that you are interested in, that you might want to pursue a DM later in the center of the page, and write down the subtopics around the core topic that you are interested in. Now, keep the paper and pen aside and follow me through the next 10 steps of how to select a thesis topic. And by the end, we'll again take that paper again and fill the thesis topic, right? Okay. Before getting into it, we'll get to know why selecting the right thesis topic matters. Because choosing the right topic ensures smooth research progress. A well-structured thesis contributes to scientific knowledge. Poor topic selection can lead to time delays and research challenges. Helps in personal and professional development. Okay. So what's the first step? You should reflect on your interest and career goals. That's why the first activity that we have given is to write the topic of interest in the center of the page. I hope you all of you have written. Okay. So identify your passion areas and align your topic with long-term career aspirations. For example, in pediatrics, they might have core topics such as neonatology, infectious disease, endocrinology, hematology, neurology, pulmonology, so on so. So write down on them in the center. And if you want to pursue DM neonatology, doing a thesis on neonatology makes sense, right? So consider all these things before selecting the core topic. Okay. Next step is to review the literature thoroughly. Go and conduct a thorough literature search in PubMed, Embase, Google Scholar, and your departmental library and your institutional library. So, why to do so? Because you should not repeat the thesis that has been done by your seniors, and it helps you find the gaps. So, pinpoint unanswered questions and gaps in the existing literature, and look for novel angles and unique angles. So search for recent publications, reviews, and meta-analysis in PubMed, Google Scholar, and institutional databases. A PG interested in pediatric asthma might find several studies on asthma prevalence, but very few on the role of indoor air pollution in worsening asthma symptoms. So this might be the gap, and this helps in avoid duplication, and it will give you a new research opportunity. Similarly, you next step is to identify what is missing and what still needs more evidence. Okay. So if already many studies are done in childhood malnutrition, but very few studies discuss the impact of yearly complementary feeding practices, this could be a research gap, right? So you can take this research gap into consideration and start your research on this. Another example might be neonatal sepsis. Existing literature might focus on antibiotic resistance, but not on biomarkers for early detection. This presents an opportunity for you to do a study on them, right? And ask yourself, how can I study this problem differently? View from different angles, and you will find and land up in a new thesis topic. Okay. The next important step to consider is to assess the feasibility and practicality of the thesis that you are taking up. Evaluate available resources such as lab facilities, clinical data, patient count, and like about the disease itself. Consider time constraints too. Assess methodological complexity and necessary skills, whether your institute or you have those skills or not. For example, if a topic requires advanced genetic testing, does the institute have the necessary lab facilities? If your topic want to conduct an institution-based studies such as among police officers or among orphanages, check whether you will be able to get permission to collect data from them or not. A study on rare diseases may struggle with sample size. So, do studies on only those diseases which you commonly see in your OPDs. Consider time constraints too. Think whether you can finish this study in 2 years or not. Doing a follow-up research for 3 years does not make any sense. Consult with your mentors and experts with the tailored title till now. Go and talk to your mentors. Engage with your guides for guidance. Seek insights from experienced faculty and peers. Use feedback to refine and adjust your topic. Your guide or mentor is the first point of contact in the research journey. They help in refining ideas, providing expertise, and ensuring the feasibility of the study. Talking to faculty members, seniors, peers provide new perspectives on the topic. Consider ethical and regulatory constraints. If your study involves human or animal subjects, then definitely ethical consideration is mandatory. And being a thesis, every thesis or research should get certification from institutional ethical committee. So strict adherence to high standards of patient safety and informed consent is needed for any study. Then define a clear research question or hypothesis. Your research question might be vague and broad. So narrow it down. Narrow down your broad interest into focused research question. Ensure the research question is specific and operationally feasible. And clarify the objectives now itself before starting the study. You should know what are the things you are going to get out of this study, not just the research question. What is the expected answer also you should know. Now it's the time to narrow down the broad topic into a specific and researchable question. The broad topics such as pediatric and asthma and air pollution can be narrowed down to impact of indoor air pollution or on asthma exacerbation in children aged 5 to 10 years. Here, if you see pediatric asthma, pediatric means which age group we didn't mention. So it is very broad and vague. And asthma has is itself is broad and vague. So whether we are talking about acute exacerbation or chronic asthma and air pollution can be indoor and outdoor. So specify it, what you want to study exactly. You specify your research topic from broad to narrow one. Okay, so this sounds good, right? Next, break down the research question into specific goals to define what you want to achieve in this study. Like I said, it is not just the research question that is important now. You should know what you are expecting out of the study. For example, if you do a research, your research question is, does kangaroo mother care improve neurodevelopment in preterm infants? You should know what are the things that you will get out of the study after doing the study. So you'll like your research objectives might be assess neurological develop milestones at 6 and 12 months, compare weight gain in KMC versus non-KMC infants. So you should know what are the things that you will get out of the study too. So next step is to evaluate the impact and contribution to the field. Your study is not just for your development, career development or passing out the PG. You should check whether it has any potential clinical, scientific or policy impact. Choose a topic that contributes to the existing knowledge. Explore opportunities for future research directions. Funding. Next important thing is funding. Assess budget and requirements and resource availability. Identify potential funding sources if needed. Certain projects will be funded by governments, NGOs. So look for them. If your topic fits their criteria, apply for funding. Explore interdisciplinary collaboration to enrich your study. Suppose your study requires collaboration between two different departments. See to that you get guidance from the both departments. You can have other people as a joint mentor in case you want help from other departments. So likewise, you can proceed on with your study topic. Before starting the research, evaluate the cost involved in terms of laboratory test, equipment, software, patient recruitment, logistics. A study on genetic markers in pediatric epilepsy might need expensive sequencing testing, which should be budgeted. Look for funding opportunities. Plan for data collection and analysis. Ensure access to necessary data sources like such as clinical records, lab data, and surveys. Identify appropriate analytical tools and methodologies. Plan the data collection progress to align with your research question. Okay, next step is to follow the institutional guidelines and requirements. This will be the final step for your consideration. So review departmental expectations such as format, length, and methodology. Familiarize yourself with the topic, approval, process and timelines. Ensure your project meets all academic and institutional standards. So, with this in mind, we'll look into what are the common mistakes that usually postgraduates does. Okay. Choosing an overly broad or vague topic. This is the most common mistake that will be done by a postgraduate. For common examples of broad or vague topics is hypertension in adults. Instead, you can specify what type of hypertension. Adults means which age group and what exactly in hypertension, whether you want to study clinical features or you want to study the prevalence or you want to compare the treatment between the two groups. So you can narrow down the topic. Diabetes and complications, likewise, cancer research. Cancer is much broader topic. Role of nutrition in health. So, like all these are broader topics. You can make them into specific, like prevalence of hypertension among office workers in urban areas, a cross-sectional study, incidence of diabetic retinopathy in patients with poor glycemic control, association between social media usage and anxiety, sleep in hospitalized children with cancer. So all these are narrowed down topics which are very specific and compared to the previous one. The next common mistake that a student does is they're like very enthusiastic. Some students, what they do is they take up a topic which is very new. Okay, so when you take up a topic which has a huge research gap, you will get stuck in that gap. So as a PG, you have to complete your thesis by 3 years. So always try to take a topic which already has fewer researchers available in the internet or in a library, so that you'll get to know how to do the research. You will get to know with the methodology of the research. Okay. Few examples like use of sound therapy for treating depression, benefits of unproven drug, and impact of rare genetic mutation. Instead, you can do some common genetic mutation on cardiovascular research so that you will get the cases. Okay, instead you can use other treatment options. You don't go into something very hypothetical or very new. Okay, so appropriate will be like effect of ginger, which is commonly used by Siddha people, and like efficacy of cognitive behavioral therapy versus medication for treatment of depression. All these things are common things. And next one is ignoring the feasibility and the practicality. So you should know what are the lab equipments or things that are required for your resources required for your thesis. Just by like that, you should not do something. For example, genetic engineering for treating sickle cell anemia. We should have facility for genetic engineering. Impact of space travel on bone density in astronauts. How many astronauts do we know? So stem cell therapy for reversing neurological damage in stroke patients. So stem cell therapy facility should be available in our hospital. So all these are impractical. So instead, prevalence of sickle cell anemia study can be done. Effect of prolonged bed rest on bone density can be done. Functional recovery in stroke patient undergoing intensive physiotherapy can be done. So all these are practical and feasible topics. Then, overlooking ethical and regulatory considerations. So, testing a new drug on pregnant woman is completely unethical. Likewise, withholding treatment from patient is also unethical. Psychological manipulation is again unethical. So, the topic like this should be avoided. While a retrospective study or observational study, which needs a lesser ethical consideration, should be considered for your thesis. Okay, so we have come to the conclusion. So what are the things that we need to consider is we should first select with the topic of our core interest. So you should write down the topic of your interest, then do a thorough literature search in it and find out the gaps in the literature and check for feasibility and practicality. Get guidance from your mentors on whether the topic is possible or topic is good. Look for ethical considerations. Have clarity on the question. Don't be too broad or vague. Narrow down the question. Make it specific and check for the impact that is it is going to bring to the community. Check for funding options, do a data plan, data collection and analysis plan, and check whether it fits the institutional guidelines. That's all. Before concluding this session, we will get to see your face, how is it looking. Okay, I think now you are more confident than before, right? Okay. So I have an announcement to make. So I think this session was in helpful in selecting a thesis topic. I'm planning the next session on protocol preparation, which will guide you on how to frame objectives, what is the appropriate study design to select from, how to calculate sample size, what are the statistical analysis that we can use, what are the ethical considerations. So stay tuned for that in-depth discussion on preparing a strong research protocol. Thank you once again for joining this session.